Hi, I'm Colin Hung with Healthcare IT Today, where we explore the latest trends and interesting stories in health IT. On this episode, we're going to talk about something that happens magically in the background, and that's storage. And we're going to talk to these two gentlemen about why we need to think maybe differently about that, and also why storage is so important. So joining me today are Josh Gluck, Vice President of Global Vertical Alliances and Solutions at Pure Storage. Josh, welcome back to the program.
Thanks, Colin. Thanks for having us.
And John Kimerle, Global Healthcare Alliances person at Pure Storage. Welcome
Good to
back,
see you,
John. Yeah.
Yes.
So let's talk about storage for a minute. You guys do business, Pure Storage does business in a multiple of industries. Healthcare is a focus of yours. Why is healthcare so important to Pure Storage?
Well, as you mentioned, Pure Storage does focus in all industries, but I think that the main value prop for Pure Storage resonates well with clinicians. In healthcare organizations, they're 24/7. You have highly motivated professionals that are taking care of people, so faster, more reliable,
right?
Not wasting money on things that you don't have to. All that makes even more sense within healthcare.
And so, one of the reasons why I want to sit down with you in particular, John, is that your title and your goal within Pure Storage is to establish alliances and relationships with the other vendors that are in the healthcare ecosystem. Talk to me a little bit more about that work that you're doing.
Well, I think it was our founder that said, no one buys storage just to buy storage. They want to do something. And within healthcare, you have to understand the entire ecosystem. Solutions are often not just one vendor or two vendors, but it's really how the vendors complement themselves. So understanding the nuances of how the different vendors might complement a solution is critical.
So I want to go to the title question, which was, how should we or could we really be thinking about storage differently? Because I got to be honest, when I think about storage, it's just something that happens in the background. I push things to the cloud. If you're lucky, maybe it's something local. But how should healthcare be really thinking about storage?
And I'd like Josh to weigh in on this as well. But as data grows, especially if you look at the social determinants of health and how most of our data in healthcare organizations today is focused on those medical determinants of health. So, easily 5-10x growth in just the data alone over the next few years. Added to that, the possibilities with AI and ML for machines to access that data. Now you've got the data growing at 10x, you've got the number of users, and infrastructure matters at that scale. So fundamentally at the scale we're going to, the infrastructure matters.
Josh, want to add something to that?
Yeah, look, I think as John was saying, data in healthcare used to be limited by the pencil or the pen. And now we're collecting more data through every interaction, whether that's in front of clinicians or care delivery folks, or it's an Apple Watch or a connected device at their home.
Right.
And using that data and putting it to use to drive improved outcomes is at the heart of everything we do in healthcare, not just in the United States, but globally. And for years and years and years, we just assumed that the storage systems that we had in those organizations were good enough.
Okay.
And for a long time they were, right? They were. But I think, there's been a lot more pressure on healthcare organizations in the past few years to make sure that they're financially viable and that they're healthy from that perspective. And so collecting technical debt and leaving old things in their data center actually costs them a lot of money. It reduces their ability to impact their patients' lives, and it increases their risk. And so being able to work with a company like Pure, where we ask that organizations invest in that data platform once and it stays evergreen for its life, really reduces some of the risks in those organizations and makes them be able to spend those dollars that they would have spent on aging equipment year over year and put it towards better use, projects that were normally below the line they couldn't afford to do.
See, I like how you put that, Josh, because what I'm hearing you say is that storage needs to be thought of as a potential risk, much like legacy systems potentially as a risk. We want that data. That data is valuable, but if it's sitting on a legacy system or a legacy storage in your case, that could that data may not be accessible.
That's exactly right.
Right.
And if you want to use that for research, you want to use that for improvements to your AI algorithms, you need to have constant access to that. And so what I'm hearing you say is you got to think of it in that terms, and therefore you'll make the right decisions in terms of investing to get it off that, and maybe onto something like Pure Storage.
Well, and it was a pivot from the way that we delivered care, right? It was episodic. I showed up and I had an interaction. Maybe that data was written down somewhere. Maybe it was collected electronically and stored off in an archive. But now what we're seeing is, as we talk about personalized medicine, population health goals, like having access to all that data so that we can improve, learn from me, but improve the way your care is delivered, that there's so much goodness in that. And without performance storage, you can't do it.
You've heard the saying, data is the new oil, but I think in healthcare, a little later to adopt that, but the data within healthcare organizations now is becoming critical. It's approaching a very important asset.
Yeah, I mean, by some estimates, some analysts are saying that healthcare will generate 30% of the world's data, or maybe already we're at 30% of it. That's a lot of data.
Yeah.
And it's distributed sort of unevenly in the healthcare organizations. It's not all stored in the same spot. What's a proper approach to that? Should people be looking to store it all in one place? Should it be distributed across multiple different storage? How do you approach that with an organization?
Yeah, I think you've got to approach it different ways, right? And I think it kind of first starts with understanding where data is in your organization, right? And I think we've both probably seen in our past careers and even in talking to future prospects or customers, getting a handle on where data is in your environment and finding out that there's some critical system that actually lives in a closet somewhere that nobody knew about, or it's sitting under somebody's desk in a lab if you're talking about
right.
research. So getting setting a data strategy and a data policy for understanding what data is in your environment, where it lives, and then making decisions about where it's best to be stored.
Gotcha.
Right, and I think we've seen organizations want to do that on-prem in their data center. We've seen organizations want to do that in a remote hosting scenario or at a managed service provider. And we've also seen people want to move it to the public cloud. And I think the benefit of the way that we focused on supporting organizations to do that has been very instrumental in organizations finding the insight that lives in that mountain of data that they didn't even know existed before. Kind of interested to hear your thoughts.
So clearly most healthcare organizations have a application portfolio that is too big. And so if you talk to every single organization, they're looking to simplify that, rationalize it. And so that's really step one, is simplifying your portfolio, inventory it, identify it, prioritize it, but just reducing the number of places that your data sits so you can better manage it is a clear strategy. And I think we're seeing healthcare organizations take that seriously now.
Final question for you, John. I got to ask this.
Yeah.
You're doing a lot of work with a small little company we might have heard of called Epic.
Yep.
Tell me what you're doing there and what you're doing with the Epic folks.
Well, we're focused primarily on helping Epic's customers make the most of their data and improve the outcomes that they're looking for. We are offering new products that allow us to access larger organizations. We have a new platform called the XL, which allows for some of the largest Epic customers to be able to run Pure Storage and experience all the value that we can give them.
Excellent. Excellent. Well, Josh, John, thank you for being on our program. You always share some great information when we're together.
Thanks,
Colin.
Hey, if you enjoyed this interview as much as I did, we'd love for you to go over to www.healthcareittoday.com, where you'll find some other great content just like this one. I'm Colin Hung with Healthcare IT Today. Thanks for being here, and we'll see you on the next one.